Hello, and welcome to the Pediatric Brain Tumor Foundation's webinar, Supporting the Sibling's Journey After a Pediatric Brain Tumor Diagnosis. My name is Heather Held, and I am the National Family Support Programs Manager for the Pediatric Brain Tumor Foundation. We are honored to have you joining us today for this important webinar. The PBTF provides programs and resources to support families facing a pediatric brain tumor diagnosis throughout their journeys. We will provide links to some of those programs and resources at the end of today's webinar. Before I introduce our presenters, I do have a few guidelines to review. You are muted for this webinar and your video is disabled, but we welcome questions during and after the opening remarks. Please type your questions into the Q&A feature found at the bottom of your Zoom window. We will not get to every question today, but we will try to get to as many as possible. Deborah Bond Berk has served as Senior Social Worker and the Sibling Program Director in the Division of Pediatric Psychosocial Oncology, Department of Psychosocial Oncology and Palliative Care at Dana-Farber Cancer Institute since 2001. Her promotion of the sibling point of view and services to siblings led to the creation of the job title of Sibling Specialist within her department and the inclusion of inpatient and outpatient sibling-specific services. She also provides psychosocial assessments and clinical support to all patients and their families diagnosed with solid tumors. Ms. Berk speaks nationally and internationally on sibling issues and serves as a charter member of the Super Sibs Advisory Board. Dr. Darcy Burgers is a pediatric psychologist within the Division of Psychosocial Oncology at the Dana-Farber Cancer Institute, where she specializes in promoting coping with illness and other psychosocial stressors among pediatric neuro-oncology patients. In her role, she provides psychosocial support and consultation to patients and families from the time of diagnosis through survivorship. Dr. Burgers received her PhD from Temple University after completing a one-year pre-doctoral internship at the Children's Hospital Colorado with a focus on pediatric health psychology. She completed a postdoctoral fellowship in psychosocial oncology at the Dana-Farber Cancer Institute, where she provided support to patients and families within pediatric neuro-oncology. Dr. Burger's research interests include understanding risk and resilience among youth impacted by medical conditions. It gives me great pleasure to introduce to you all today our presenters, Deborah Bond Berk and Dr. Darcy Burgers.
Next.
Well, thank you so much for joining us all here today. For today's talk, we hope to highlight the importance of the sibling point of view and experience of having a brother or sister with a pediatric brain tumor diagnosis. We're planning today to share some information about the psychosocial adjustment of siblings, including the impact of psychosocial interventions, as well as research findings on siblings specifically, signs to look for when considering sibling distress, sibling reactions and perspectives of their experience, and school challenges and ways to support siblings in the school setting. We're also hoping to highlight some special considerations for siblings of patients with a pediatric brain tumor diagnosis, as well as share some tips and considerations around communicating and supporting our siblings. And lastly, we have a number of resources and tools for parents and siblings alike to help support them through this experience. And we hope at the end to have some time for questions as well from the audience. Next slide.
So I'm going to begin talking about the importance of the sibling point of view. I want to take just a moment to say that when I came to Dana-Farber almost 2 decades ago, there was a once-a-year program for siblings. I observed and participated in that as a new staff member and was then basically told, so next year is your responsibility. And it felt a little bit like a handoff, not necessarily in the best way. And so when the siblings began to come into the room, we had all kinds of activities and a puppet show for them. I was really struck by the poignancy of these siblings and the need that they had for more support. Total family care has always been really the bedrock of Dana-Farber Cancer Institute, and I'm sure for all of you as well. Because when a child is diagnosed with cancer, the entire family is impacted and everything is really, really turned upside down. Next. Research has shown, and we have also found, that providing psychosocial support to the siblings supports them enormously and gives them the possibility of coming through this major life event in a more whole way. Excuse me. We've also noticed that some of the siblings go into the medical field or a helping profession as a result of what they've experienced. I will talk later about these prescribed psychosocial activities, and of course, we'll talk also about what's happened during COVID. Next. Research has shown us that this is a different way of being in the family. And importantly, siblings often rely on their own understanding of what this illness means. We focused a lot with the siblings on the fact that this is nothing they caused. This is random. Nobody knows why it happened. And it's not because they were angry at their sibling, their sibling went out without a coat, they didn't take care of them. Really, nobody knows why. And it's very, very important, if at all possible, to have medical providers be available to talk to the siblings more specifically about what's happening. Next. These are some research findings which you can look through on your own later. I think it's important to note that the siblings have very unique psychosocial needs, and that we really want to understand what those issues are so that we can best support them. There are warning signs of sibling distress. We have this slide here, but obviously there are just some or none of these that might pertain to a specific sibling. One of the ones that I think is very important to highlight is the overprotectiveness of the patient. I think sometimes, understandably, that's viewed as a real positive. The sibling is really being supportive, they're worried about the patient, they're doing a variety of things for them. But we have to think also about how this has changed their views of their role in the family, and also how has this impacted them in terms of their own ability to continue with their lives. You know, the older siblings often talk to us about feeling that getting a driver's permit, a prom dress, a sporting event isn't as important because of what their sibling is going through. So we really would suggest that people pay attention to these kinds of warnings. Next. Over time, I found that the most poignant and powerful way to understand the sibling experience is to listen to what they have to say. These are changes that siblings describe that they've experienced at home. It's okay. I'm going to show now a video that's from our Sibling Voices video. The reason that I'm going to show this is that it really speaks to the discrepancy between what the person feels is happening at home and what the person feels is happening at the hospital.
Mom just say I gotta clean up the house too. No. Yeah, Mom just told me that, and then I hear it when you're not here. You're kidding. No, I'm not. Yes. No, I'm not. Yes. No, I'm not.
Next slide. So this is also addressing the sibling experience. They often feel lonely, helpless, grumpy, bugged, confused, mad, and sad. An older sibling, when we were doing an activity, put a Post-it up that said secondary. And we really didn't know what it meant. Was it a football kind of thing, or what was he talking about? And we asked him, he's the oldest of 4 siblings. And he wrote secondary because he felt that his place in the family had come down because the patient was now the primary. And it's a very powerful reminder to us about what this can feel like for siblings. Next. These are things that the siblings worry about. This one where I worry, but I have to worry about my education too, is particularly important when we think about the impact of the sibling either attending Zoom school or not virtually and actually being able to go there. And their misunderstanding that their friends often have about whether or not cancer is contagious, and whether or not it's okay to play with them, and whether or not it's okay to visit them. And how do they understand that maybe you can't really go to see your friend if you have a cold or a little cough because of the situation with the patient. Next. So speaking again about school, because I really think it's so important. It's very, very critical for siblings to receive support there. There are a variety of resources that we found are helpful. The Sibling Voices video, the tips for teachers, which you'll see later. And over time, as schools have begun to incorporate this notion of different ways of being in the family, and that families have all different ways of being together, there's more room for siblings to speak about the changes that are occurring in their family. Next. This is part of the tips for teachers. It's really, really important. We've found that while teachers often have either a family member, a member in their community, at their workplace, who have had to deal with the cancer diagnosis, it does not mean that they understandably are aware of sibling reactions. We found over time that in consultation with teachers, guidance counselors, and principals, they're very appreciative of this information as it's a way to educate the educators. We also don't want siblings to ever feel that difficulties they're having, decline in academics or extreme productivity because they're overcompensating, or tardiness, is something that is not understood and in a way can be punished. Next. This video you're about to see speaks to some of the experiences of the older siblings and really addresses the school issues.
For school, well, I have like a lot of tardiness now, and I'm trying to fix that, and I'm working on it, because I was pretty good at school, and now I've noticed that my grades went down a little bit since my mom's not home.
Next. Continuing on with the tips for teachers, these are interventions that are very helpful. I want to say here that families are very appreciative of this kind of support because they worry about the sibling. They are aware that this is compromising the sibling as well, and they're really eager to support them. So this is really important. And a lot of times siblings say, don't ask at school how my sibling is doing. I just want to be there. With that, it's still very important to have a point person available in the school so that if it's a difficult time or a moment, the sibling has somebody to go to. Next. Here are some of the tips for teachers which provide support for the siblings. You know, I have to say that a young sibling maybe isn't as worried about this, but a high school student who's worried about taking exams and figuring out what they're going to do at graduation need a lot of support. And also, you know, schools, you know, support can be from outside the school, right? From the educator, it could be a teacher, a coach, a close friend. Next. Here again, we're talking about ways that siblings can be supportive. These are things that they basically have said that they would like their parents to do. I know that this is something that guardians and parents really struggle with. It can be a very, very simple thing that provides support for a sibling. I know that we have a little sheet of paper and it says, I promise that I will. It doesn't have to be something fancy. go get ice cream with you, go for a walk, read you a story. It's just a way to sort of acknowledge that the sibling isn't forgotten. Next. This has to do with the future, what siblings are hoping for in the future. I think that Darcy and I find this very poignant because with both of our cases, and in general these days, there are relapses, progression of disease, and a lot of trials that kids are going on, patients are going on. So while we hope that this occurs, it has become clearer over time that there are more options, which is wonderful, but it also can really prolong the sibling experience. And just to quickly say that with all the trials, whether or not you have a family going away from your place to a different hospital or vice versa, that impact on siblings is enormous. Sometimes they are moving completely across the country, out of state, don't know anybody, to be with the family while a trial is initiated. So that's something I think over recent time has added to the sibling experience. Next. Darcy's going to now take over and speak more about the specifics around pediatric brain tumors.
So Deborah has highlighted for us all some of the many common difficulties that siblings may face when another sibling has been diagnosed with cancer, like feelings of worry, anger, sadness, helplessness, jealousy, and guilt. And as you might have all observed in your own experiences as a parent or caregiver or a healthcare provider, all of these feelings are especially applicable to our siblings of patients with pediatric brain tumors. There are some additional considerations for these siblings that we do want to highlight, just given this unique population of pediatric brain tumors. So one important consideration to keep in mind is that no two brain tumors are exactly alike. There's a really wide spectrum of brain tumor diagnoses and types of treatment offered, and that all may depend on a variety of factors, such as the type of brain tumor itself, its size, and its location. With that, treatments can really vary. Some patients might be followed with surveillance MRIs only. Some may require surgeries to biopsy or remove part or all of the tumor, and some might require chemotherapy, which could occur inpatient or on the outpatient side and may occur intravenously or orally with a variability in clinic visits. And sometimes treatment can involve radiation or a combination of all of the above. And depending on the treatment plan, siblings themselves can face disruptions in their daily routines, as Deborah's talked about earlier. And that can also include prolonged separations from their sibling and their parents, especially for those requiring frequent or extended hospitalizations or travel for different trials or treatment opportunities. Additionally, treatments for patients have evolved a lot over the years. So depending on the time of diagnosis, treatments offered might look really different as newer treatments and clinical trials have entered the playing field. It's also important to take into consideration the impact of the tumor and treatment, including late effects, which can appear months to years following treatment for the impacted child. Patients can experience neurocognitive changes both during and after treatment. And this might look like changes to their memory, attention and concentration, their executive functioning, their processing speed, and their learning. There can also be neurological and neurosensory changes, such as fatigue, impacts to hearing and vision, difficulty with balance and coordination, and the onset of seizures. And just as the tumor and treatment might have an impact on the patient themselves, siblings may also be impacted by observing these changes in their brother or sister, who now may appear to be different from what their sibling once viewed them to be like. And as a result, the patient and family and the sibling experience from diagnosis through treatment and beyond into survivorship can look really different for each individual patient and sibling and their particular situation. Next slide, please. Though much of the existing literature on siblings tends to group siblings together regardless of the diagnosis of their affected sibling, there are some past studies that look specifically at siblings of patients who have been diagnosed with pediatric brain tumors. And in this work, siblings have highlighted some different challenges that they faced as the sibling of an ill child, which really varied depending on the phase of their sibling's treatment. So for example, siblings noted experiencing jealousy and difficulties with obtaining peer or community support during their siblings' hospitalizations, as well as difficulties related to health fears and overprotection following treatment. Siblings have also highlighted that the need for their brother or sister to have additional therapies beyond their original one was particularly challenging for them, which we often see in our population. Siblings have also highlighted challenges that they faced during their siblings' brain tumor diagnosis and treatment, which focused a lot on how the medical team and their parents or caregivers have provided siblings with medical information about the patient, such as around the cause of the tumor, as well as general medical updates about their sibling during hospitalizations and beyond. Siblings also identified a need for additional homework support throughout their siblings' hospitalizations and afterwards, as well as challenges around coping with the changes in their sibling that they observed, which might include things like the sibling's physical appearance, changes in their activity level, and changes in their mood and behavior. Siblings of pediatric brain tumor patients have also identified different resources that have been helpful to them throughout their siblings' diagnosis and treatment and beyond. And this includes a focus on the importance of getting support from the family, their peers, and their broader community, as well as family harmony, that is getting along with their family members during this experience, and the ability to visit their siblings during hospitalizations as possible. Next slide, please. And just as those as you in the audience who are parents or caregivers might have done with your child who's the patient going through this, it's also just as important to give accurate and honest and developmentally appropriate information to siblings about their brother and sister's diagnosis and treatment. I often advise parents and caregivers that they're the true expert on their own children, and it's really up to caregivers to select the specific language and words that they want to use as a family to talk about diagnoses and treatments with their children. A lot of times parents I work with tend to use the word tumor just because that's a word that's frequently used by their medical team in visits, so it's often overheard and is sometimes difficult to avoid at times. Some families also enjoy reading books or showing videos to siblings that help to explain what's going on medically. And these might also be used with patients as well. I think this can sometimes take some of the pressure off of caregivers of trying to find the exact perfect words to use when talking about medical procedures and things coming up. And then it also allows time for caregivers to sit with their other children to learn together about what the patient's going through. And especially for siblings who might not be as involved in medical visits or hospitalizations as the impacted child who is the patient. Honest communication is really important in order to provide your other children with clear information about what's going on medically or what might be about to happen or happen down the line, such as upcoming procedures like surgeries requiring extended hospitalizations, or big changes like changes in the sibling's appearance or side effects of their treatment, as well as just changes to the family schedule and plans. Children can often sense parental concerns or have a feeling that there's more going on perhaps than they know of. So they often tend to make up explanations for these things in their head to fill in those gaps. So again, it's important to provide information in a timely way with your other children. And in addition to providing this honest and developmentally appropriate information about the patient's medical needs, it's also really important to provide siblings with a space to ask questions so that as parents and caregivers, you can be aware of your children's fears and concerns and as well as potentially have an opportunity to address any of those common misconceptions that a sibling might have about what's going on, such as fears that they might be able to catch their sibling's tumor or that they caused their sibling to get sick. And additionally, even if you don't know the answer to the sibling's questions, you can always let them know that you'll look into it or ask the medical team for more information, which can help to alleviate their fears and concerns. And as Deborah mentioned earlier, sometimes it's helpful, if appropriate, to include the sibling in some of these medical discussions and provide them with opportunities to ask their own questions of the medical team as well. Additionally, appropriately sharing your own emotional reaction as a caregiver can also help your children know and acknowledge that it's okay to feel and to express these more challenging emotions in safe ways, like feeling sad or angry when your child's sick, or that you miss your other children when you're in the hospital. It's also helpful to share how you cope with those challenging feelings. So you might share with them, you know, when I feel angry, I like to go for a walk around the hospital to feel better, or to call you over FaceTime to check in. Additionally, it's important to be aware of and to acknowledge that your child's illness is impacting your other children. This helps to validate for your other children their own emotional experience and can reduce their potential feelings of danger or threat to their safety, and can also lead to positive and improved parent-child interactions. Additionally, recent research suggests that parental awareness of siblings' emotional experience can help to normalize siblings' experience of both positive and negative emotions and help lead to parents initiating discussions around the siblings' emotional experience, which siblings have found to be beneficial. And also, given the awareness of how siblings are impacted, it's really important, as we've mentioned, to provide consistency and maintain routines for siblings as much as possible, as this helps to create a sense of predictability and reliability for them when their worlds are sort of being turned upside down. Next slide, please. And so in addition to some of these communication strategies, as well as the other supports that Deborah has mentioned earlier, it's also beneficial to support your other children in these ways as well. It's especially important to engage with your other children and find opportunities for one-on-one time when possible. This could look like doing a special activity or reading a story together at nighttime, or even just finding time to talk briefly during a car ride. Providing this special attention may help to alleviate those feelings of jealousy that the sibling might have, that their brother or sister is getting all of the attention or that they're not as important. And as mentioned earlier, siblings often may feel that they don't have all of the information that they want about their sibling's medical experience. So as such, involving siblings in the medical experience as much as you can help to alleviate their concerns and show them firsthand what their brother or sister sees and does at the hospital or clinic, which can often be viewed as this mysterious place for siblings. So prior to the COVID pandemic, this could have been done by bringing siblings in to visit the hospital or clinic. That's a lot more challenging now with ongoing visitor restrictions. However, it can potentially be done virtually. It could also be done by finding a way to communicate with siblings who are at home while their sibling is at the hospital, which could include sending cards or virtually connecting by video chat. Additionally, siblings, if interested, can also help and contribute to events to support their brother or sister, such as by participating in fundraisers or doing walks in their siblings' honor. And as available, psychosocial providers such as child life specialists, social workers, and psychologists can help to offer supports to siblings. And actually in 2015, a number of standards for the psychosocial care of pediatric oncology patients were published, and there's even a specific standard devoted to the importance of screening for and supporting sibling psychosocial needs. And psychosocial providers can be a great resource for families to help think about the language and information that you want to share with siblings, as well as provide additional sibling supports and attention throughout treatment and beyond. And one of the ways that we offer supports to siblings here at Dana-Farber is through some wonderful sibling group programming that Deborah has taken the lead on, which is currently happening over Zoom. So Deborah, would you mind sharing a little bit about the groups and how they've been going?
Sure. So to begin with, just to take a step back for a moment, we certainly miss the siblings not being able to be at the clinic and at the hospital. You know, a number of years ago with the H1N1 flu, siblings weren't allowed to come in for a period of time. And I actually feared that they would never be allowed to return because it was a lot quieter without them. But staff and families and patients felt that everybody coped better when they were able to be around, and that it was a way to keep the family together. So historically, having siblings come in for activities has not always been easy, as you can well imagine, given a whole variety of constraints. As COVID really took off and we realized we were in this for the really quote unquote long haul, we started some Zoom programming, which has been absolutely terrific. It enables siblings, no matter where they live, to join and be with other siblings. They have really enjoyed this, and the Zoom group has gotten so big that we now have a couple of breakout sessions so that we can work with the older and younger kids separately. So this has been well supported by parents and is something that we feel we would continue even in the future when COVID's no longer an issue. This is a way for siblings to connect together. And one of the really difficult pieces for siblings is that they don't know anybody else that's going through this. They feel very, very alone with this situation. And so being in a Zoom room and looking around and talking with other siblings who are going through a similar situation is remarkably therapeutic for them. I also want to just mention that there are very simple ways to support siblings. One of them is to have a pamphlet put together that has sibling resources in it that can be handed out to guardians and parents. This just really communicates we are aware that siblings have issues and we want to support, as I said previously, the entire family. Another way to support them is that they don't know what the clinic looks like. They don't know where their sibling is going. And so being very careful around HIPAA issues and staying with the patient throughout, we found that a small recording of where, of the medical team, meet my nurse, this is where I get my vitals done, this is what it looks like, is a wonderful way to communicate to a sibling who can't come in how things are going. I also, if there are giveaways, which we sometimes get, right? Somebody drops off a huge thing of stuffed animals. There's a culture now that is really heartwarming, which is don't forget to bring something home for your sibling. And I think by doing that, we're encouraging everybody to remember what sometimes are referred to as shadow children, which is something we obviously do not want to have occur. Next slide.
So we have compiled for you a list of resources and tools that might be helpful as you learn more about how to support siblings. And this list is certainly not exhaustive, but it's a nice place to start. So first we have some different books that families we work with have found to be helpful. First is a book geared towards parents and caregivers just to learn more about childhood brain and spinal tumors, but there are some nice sections on siblings and how they're impacted and how to support them, as well as some helpful language, I think, around talking about some of the medical experience. We also have some books here that families we've worked with have found to be helpful to read and share with siblings. These books provide some important information about diagnosis and treatment. They normalize feelings that siblings might be experiencing, and again, also help to provide some additional language for the family to use around what's going on and how the family is doing. And though there are a number of books more broadly about the cancer experience for sibling, which are really wonderful, there aren't a lot specifically about patients who have brain tumors. The first one we highlighted is about a little boy with a brain tumor. So I think that is a helpful one for our families, but the other ones I think are also just as beneficial, but might have different wording or language around some of the medical piece.
And if I can just add this, a day with Dr. Waddle, Darcy and I were talking about this. This is actually, if the siblings are sort of the same age, it has very user-friendly information about cells and cancer and microscopes. And that's something that a family could do together. And, you know, resources and finances are always an issue. But if you can find some donors to get these books on site and then give them to parents, it's also a wonderful way to open up dialogue around the sibling experience and support.
And we also always encourage families to look through the books and materials first before sharing with their children, just to get a sense of their own comfort with the material and the language used, as well as checking to see if the situations in the books align with the patient's experience. So sometimes books might talk about different medical treatments or procedures than your own child needs. And so we always just recommend looking through it first and then tweaking language or skipping over certain sections if you feel like, you know, it's not going to be helpful to talk about that with my family because it's not applicable to us now.
Right. Of course. Right.
Next slide, please. We also have a number of websites here for you that have additional information. Some are sibling specific, such as our sibling program here at Dana-Farber that Deborah runs, as well as the Super Sib program through Alex's Lemonade Stand. We also have a number of websites here that are specific to pediatric brain tumors or more general oncology, which have further information about sharing diagnoses and medical information with children, as well as various supports for patients and families, both locally and nationally. And as you already know, the Pediatric Brain Tumor Foundation has excellent resources and information on their website. And I did want to highlight some of their videos through the Imaginary Friends Society, which have these really adorable videos that can provide some helpful language around different aspects of the medical experience, from learning about a diagnosis, different treatments and procedures that might be required, being in the hospital, and impacts of treatment. Which can be appropriate both for the patient themselves, but also for the sibling and family members. And then we've also highlighted some other organizations that focus either on childhood brain tumors or general pediatric cancer, which offer various supports for families, including connecting families going through this experience together. And just as a caveat, particularly for the pediatric brain tumor population, social support in this way can be incredibly beneficial. However, when speaking with families about these types of supports, we always encourage families to explore and look into these supports with an open mind, but also with an awareness that supports in broader social areas might not always be a good fit for everyone, and that it can be challenging at times because some folks might end up making some comparisons between their child and their family situation with another, which can be really different even if they have similar or the same diagnosis. So we just encourage families to keep that in mind and just have an awareness and a pulse on if you notice starting to feel yourself making those comparisons rather than really enjoying the benefit of connecting socially with others. Next slide, please. And lastly, we have some programming and materials geared towards supporting siblings, including beads for sibling programs that are similar to beads for patients programs, where siblings can get various beads to mark certain stages in their own sibling experience. There's also some information from Alex's Lemonade Stand about siblings for times when they might be in the care of a temporary caregiver, such as if parents are in the hospital with a patient.
Darcy, could I just take a moment to highlight the KISS form for a second? So this was actually developed by Super Sibs, and Darcy and I really want to recommend it for young school-age kids. And we've seen parents being able to utilize this with the sibling. Like, let's talk about this together. You know, what are your favorite things? How do you like to go to bed at night? What foods are disgusting, you never want to eat them, and what do you want for dinner? And it's a way for certainly a parent or caregiver to feel more comfortable, but it also communicates to the sibling the thought and care that's being taken if they can't remain at home for a period of time. Thanks, Darcy.
Sure. We also have here the link for the Sibling Voices video that we shared a few clips from as well for your reference, and the link to the Super Sib program that Deborah was just mentioning. And then we also have here a list of some camps for patients who have been diagnosed with cancer, but a lot of them also have programming for siblings or the broader family as well. So we encourage you to check them out, as this is another opportunity for additional support for siblings. Next slide. And so we just want to thank you all so much for the opportunity for us to share with you a little bit about supporting siblings. And I think we have some time.
Thank you, Deborah and Dr. Bergers, for your presentation. Such rich and meaningful information for all of us. We really appreciate you both and your time today. I'm Kathy Riley, Vice President of Family Support for the Pediatric Brain Tumor Foundation, and we have a few minutes for Q&A, so I'll lead us in that portion of our webinar. We now welcome questions from all of you. Please type any questions you have into the Q&A feature at the bottom of the Zoom window. We received a few questions at registration, so I'll start with those, and I'll call on one of you at a time, but please, let's have this be a discussion. Feel free to chime in. One question from a parent, and Dr. Bergers, I'll start with you. How do I explain to my child that their sibling might be changing throughout the diagnosis? For example, they might change physically, verbally, and have cognitive changes.
That's a really great question, and I think there is no sort of perfect way to do it. It's really the way that the family feels is beneficial. I think especially with the brain tumor population, the changes we see happen at different times, both throughout treatment and then beyond. So I think it's helpful to think about kind of the present moment and what families are noticing, and as well as preparing a little bit for the future without maybe going too far down the road, because a lot of things may still be up in the air and we might not have clear answers yet. But I think being able to have a discussion with siblings about the changes that the siblings themselves are noticing in the impacted child, and talking about how that can be connected to the tumor and the treatment. And at the end of the day, this is still our sibling and a part of our family who we love.
We've had a question from one of our healthcare professionals, and Deborah, I'll direct this to you. What are some ideas for working and interacting with siblings during that initial diagnosis phase?
I think this begins with the parents or guardians. This begins with, you know, whether it's a day one or a consult or whatever it is, to communicating that we believe in family-centered care, and so that includes the siblings. You know, there was a parent who told me that somebody came up to her after her daughter was diagnosed and said, "I want to speak with you about Jane." And she said, no, I'm not here about Jane. I'm here about Susie. And she said, "No, actually, we want to talk to you about your daughter too." And so I think this initial information that we give, that we're aware of the siblings and we're going to support them and to give them some initial ideas about what to say. We want to communicate, as I said before, nobody knows why this happened. It's nobody's fault. Things are going to be different and still the same in some ways.
Thank you for that. Dr. Bergers, we have had a question about, and you addressed this a little bit in the presentation, but siblings will want to know how their brother or sister got a brain tumor. And often we've heard, can I catch cancer? What are your recommendations for conversations around how to explain the diagnosis and how, how to explain cancer to a child?
I think in terms of just some of the common worries that both patients and siblings alike might have about diagnoses, it can be really helpful to ask the child themselves about the questions they're wondering about or the things that they're scared of or thinking of. And I think that can first be a place to start for parents and caregivers, just to really get a sense of where their child's mind is at, and let them know what they're most kind of concerned about, so they can make sure to address it and to help them understand. I think in terms of disclosing diagnoses to patients and siblings, it's really important, as I mentioned, to think as a family of the language that you want to use around it. As I mentioned, I know, at least in my experience anecdotally, the word brain tumor are used a lot with our population and are sometimes difficult to avoid in the clinic setting. And so a lot of families opt to name it in that way. Other families might choose to use the name of the actual tumor that their child has because that fits for them. And others might call it like a mass or a lump in the head. I think the language we use really varies depending on both the age and developmental level of the child, which can be really different. There's a really wide spectrum, but I think in some of the resources we shared, there are different levels of kind of medical explanations of the diagnosis, as well as treatments that can be really helpful to refer to. And again, as we mentioned, encouraging families to be the expert on their children and to know where they're at and the information that would be helpful for them to have to really understand and process what's going on.
And from my point of view, I think it's also it can be very difficult if a family uses a common word, like Darcy mentioned, like a bump or something like that, because it leaves the sibling frightened sometimes, that they have a bump, they just smack their head on something. And does this mean this is going to happen to them? And I think that we all have to be really thoughtful about sort of these common words that we can use to describe something which is not common at all, and can really, really be frightening. So I really think that's very, very important to be sure of. And again, just to restate, it's the issue that this is random. This is nobody's fault. It's nothing that you did. It's nothing you thought about. Sometimes the sibling will say, I was really mad, and I'm not even going to tell you what I was thinking to myself about my brother. That's a lot to carry. And we didn't have time, Darcy and I, but we're well aware that cultural and religious differences play a huge role in how families want and need to address these kinds of times in their lives.
Thank you both. And we have another question that's come in the chat, and I think I'll ask it I'll ask both of you to provide some input. How do we handle an increase of fears and anxieties in the sibling? They're not related to the diagnosis, but came about after the diagnosis.
I would hesitate to think that they're not related to the diagnosis in some way. I think that we all hope that the siblings are not affected this way, but as Darcy and I touched on, research indicates the contrary, that they are deeply affected and can have, issues of depression, anxiety, academic concerns. And I think the best way to deal with that is to address it directly, that we know that, brothers and sisters are often anxious and worried when they have a sibling who has a brain tumor. And, you know, to sort of generalize it, I think is sometimes a good idea. And what would be the best way for them to talk this through? It might be, you know, that they need some outside support, might be some short-term therapy or psychosocial person at, you know, at the hospital or clinic for them to be able to talk about it. And finally, before I turn it to Darcy, we never want these feelings to go underground. So even though it can be really difficult to hear somebody say what it is that's making them depressed or withdrawn or not doing well in school, one of the biggest dangers is the sibling having these feelings and emotions and keeping them in because they feel like it's rude or they're adding, big issue is adding to stress in the family.
Yeah, I agree with everything Deborah said. And I think to add, I think providing space to normalize that experience for the sibling is important, and to validate how they're feeling. It makes sense that they're worried or scared or nervous about these different things. And I think it can provide a nice dialogue for families and caregivers to talk about in an appropriate, developmentally appropriate way, like their own fears and concerns and how they manage them and navigate them. Be it their own personal kind of coping strategies, or if needed, getting additional outside support, which I think can be really beneficial and for siblings provide a safe space for them to discuss these kinds of concerns that they have. I know a lot of siblings I've worked with sometimes struggle with sharing with families when they're not doing well because they don't want to add to the stress that the family's experiencing. So providing a space for siblings to express when they are feeling nervous or scared, as well as additional supports like at school, as Deborah mentioned, or outside in the community, I think can be really helpful and feel like a safe place for siblings to express how they're feeling and also learn some additional coping strategies to help them when they are feeling that way.
We've also had a question come in about sibling support groups. So Deborah, I'll direct this to you. What are the ages that sibling support groups are broken into? And do you have just one sibling support group, or do you break it up according to ages? And what are your recommendations for ages and participating in?
It's a really good question. So at the present time, we have what we call a school age group, which is ages 5 to 12. That is obviously a very broad developmental view. So recently we have met together and then broken into these sort of breakout sessions so that the older kids can talk separately. We're about to start a teen Zoom group. We're very hopeful. We've got a good base of kids to start with, but that we haven't started that yet. We currently are doing the Zoom groups once every 3 weeks. We're having them at 6 o'clock in the evening because people tend to be home. You know, it's a little dinner time-ish, but it seems to be working quite well. And you don't need to do this, but we've been able to send some activities ahead of time to sort of unite the group around a particular theme or activity. I can't speak enough to how wonderful this has been. We used to have this annual April Sibling Week, which brought in a lot of siblings, but it was a one-time and done kind of thing. And so I'm a big fan of the Zoom group platform. I think it's really a great opportunity for them to be together. And, you know, they come from, you know, internationally, and they've been able to just join together because it's, as I said, to be able to be in a room with other people that are going through this is incredibly impactful.
We have one final question that I'll direct to you, Darcy, and then we'll finish up our time together. But we've talked a lot about fear and anxiety, but someone is also asking about the future, and the future can be uncertain when it comes to a pediatric brain tumor diagnosis, and you know, waiting from MRI to next MRI. And so, what are some ways to explain an unpredictable, uncertain future to a child?
Yeah, I think that's a really wonderful question, and it applies perhaps to everyone involved in the family, for parents and the patients and the siblings as well. And I think naming that, you know, we are doing everything we can, and we are checking in with MRIs to make sure things are looking okay, and if we do learn that you know, there is more to be done, the medical team is doing everything they can to support the patient. And so I think providing reassurance of this is just a way for us to keep getting check-ins and get more information, and acknowledging we're not, you know, we don't know, but we're doing everything we can. And I think that an honest but optimistic approach can be really helpful in coping with that uncertainty that everyone's sitting with.
And to just, the other issue is to figure out the best way that the sibling can cope throughout that time. You know, to be very clear, we're not going to really know results today. We probably won't know results until X amount of time. And then when you're waiting for results, which as Darcy pointed out, is just universally so difficult. Where's the sibling want to be? Do they want to stay home from school that day? Are they going to get a call? You know, how is that going to be negotiated? I think it's really important. And this, you know, Darcy and I speak to parents about this all the time. Do you want to wait till you come into clinic and speak with your team? Do you want to have a phone call? When is it good? So all that information really in an age appropriate developmental way should be shared with the sibling. So they're not out there wondering when they're going to hear.
Thank you both for your thoughtful answers and for participating in the presentation and the discussion with us. I'll invite Heather back now to close us out.
Thank you. I want to say thank you to Deborah Bond Berk and Dr. Darcy Burgers from the Dana-Farber Cancer Institute for your time today in sharing expertise and experiences and tools with us. Thank you, Kathy, for leading us in that discussion of today's questions, and Cynthia for your behind the scenes assistance. I also want to thank you, our attendees, for your participation and thoughtful questions. The PBTF is here to help you no matter where you are in this journey. Please reach out to us for support at the contact information on this slide. We'll be sending you a link to the recording of the webinar, and we'll also send you the slides at the email address you registered with. We have several resources to help you in your brain tumor journey. We're launching our new virtual support group starting April 27th and May 4th for families 1 to 10 years from diagnosis. These groups bring together families facing similar struggles in a safe environment, and applications are now open. The Imaginary Friends Society is an award-winning series of short animated videos introducing pediatric cancer treatments and other subjects to children in an easy to understand way. In the collection of videos, you'll find one specifically addressing siblings. And finally, to learn more about our monthly webinar series, past and present, visit the link listed here. On May 4th, we are hosting a town hall about the many ways that you can participate in the PBTF community. Volunteers and families from across the country will come together to share the variety of ways that they engage with the PBTF through our programs, resources, and events. I thank you again today for attending our webinar. And please reach out to your family support team at the PBTF if there is anything we can do to help you.
Thank you very much for inviting us.
Thank you.